Welcome to Endgame with your host Psych and Dr. Brandon. Today, we'll be talking about reducing anxiety in hospitals.
Awesome. Thanks, Fubar. Welcome,
Thanks,
everyone.
Fubar.
Sorry we're a little late. We are ready to go. Yeah, this is sponsored by Windows. Windows 10, never update your operating system.
Never do it.
Yeah. But yeah, Brandon, excited to have you on the show. You have been doing really cool stuff in the VR space, especially in hospitals and in the medical setting. And we're kind of going to be talking about how VR can be used for these different kinds of, for pain and for anxiety and stuff like that. And just to remind everyone, this is a kind of open discussion. So if you have a question, you can line up in the center and line up behind people and or comment or anything like that. And so, but yeah, Brandon, do you just want to kind of give a little bit of background about what you're doing?
Yeah, thanks. Thanks, everybody. This is awesome. I'm a big fan of social VR, although I'm learning as I go. So I've been doing VR research for about 3 years, 3.5 years. It's about the same for almost most MDs. Essentially, once the Oculus Rift came out, we all started thinking there's something to this. And so, like many, I essentially had a friend who had a dev kit, did the demo, and essentially I remember seeing a T-Rex coming down a hallway and immediately was like, oh my God, there's something to this. So it was immersion, my first trying with it. And then just started reading a lot of literature, particularly around anxiety for procedures. I wanted to get my hands right in there with doing studies. So over the last 3 years, I've done studies on pain reduction and on anxiety, particularly dental anxiety, actually.
Dental anxiety.
Yeah.
So what is that exactly?
Yeah, that's a great point. So there's a lot of different types of anxiety, but probably one of the most prevalent is dental anxiety. So almost 30% of the U.S. has anxiety around dentistry to the point where they will miss an appointment or delay. And
I just want to get a quick poll of how many people here have anxiety about going to the dentist to the point at which they delay. So thumbs up if you have that dental anxiety to that point, and thumbs down if you kind of generally go to the dentist on time and stuff like that.
Oh, when should you go to the dentist?
I don't
know. So thumbs up if you kind of have dental anxiety and avoid going to the.
Oh.
Yeah. Okay. So it looks like about half. I mean, a little bit higher maybe.
Yeah.
Yeah. So okay. So
thumbs though.
Yeah. So dental anxiety pretty high. Okay.
Pretty common, and so so it's almost a kind of a unique anxiety in and of itself, given that it's so high. But because of that, there's been actually a fair amount of research papers. So when I started this 3 years ago, there was 15 publications on using HMDs actually specifically for during procedures like tooth cleanings or even some injections in one paper for an extraction, which is pretty impressive. Those can be painful. And so they were doing simple things, and that's kind of why I started in dental anxiety.
What are what?
What are HMDs?
Head-mounted displays.
Head-mounted displays.
Sorry.
Yeah.
It's the thing that's on your head right now.
There's
mostly back then. Go ahead.
A lot of VR research is confusing because they say virtual reality, but they're talking about really a 2D screen that has graphics displayed on it. And HMDs are immersive virtual reality, or really HMD, because immersive VR could also be a cave system where it's projected around you. But you're talking about like people are wearing a headset, they're in the scene kind of thing.
But I would agree that most of this actually wasn't immersive. And so a lot of this was LCD monitor headsets. So things like Vuzix has a few that really are just TV monitors with traditional content. And so of those 15 publications, most of them were traditional content, and only 2 or 3 had real VR, and usually that's Snow World, which we'll talk a little bit when we get to hospitals and pain in hospitals. So that's why I thought what we could do, I worked with a couple just independent developers, and we made Void Theaters. So Void Theaters, who all here has seen Netflix VR and Hulu VR?
Yes.
Yes. Okay.
It's only on mobile VR actually, so.
Yeah. Yeah, you guys are way above all that. So they, essentially they're a big screen. So you go into an environment. The scene is essentially just a basic skybox with a regular one color, like black or maybe blue, and then there will be a floating TV screen that you can embed a video on, and then it will follow the center of your headset. Wherever your head goes, the um, the video will go. So what we
Oh,
did
that's
was
smart because
we
they
made
ask you
about
to turn on the tape. Yeah,
exactly
when they're doing the procedures. Yeah.
exactly. If you think about it, head restricted procedures like dentistry, you can't do real, I mean, traditional VR, right? Like right now, we're all being able to turn as much as we want, and they're cranking and they're doing stuff inside your mouth. So
Yeah.
so I was essentially experimenting with YouTube videos, taking really like relaxing YouTube videos and giving that to patients to use at a few different clinics in Tennessee. Um, and I would assess their level of anxiety using a scale. It's a dental anxiety scale. And essentially it's 4 questions to figure out how anxious are you. So it was pretty interesting. Essentially what we found out through our pilot was that you have really significant anxiety. You very much wanted to have a heads up display on and kind of escape the environment as best you can. And if you had a really low dental anxiety, you essentially really were very social, and you wanted to actually kind of engage. Those patients wanted to engage the provider a lot. So they really didn't need VR.
And didn't
so
they
it's
prefer?
kind of interesting to be able to.
They preferred not to have VR, right? Like they disliked it specifically. That's
Right,
interesting. Yeah.
because if you think about it, you're going to be in that chair for an hour, right? And like with mobile VR, we were using Samsung Gear VR, maybe a couple merged VR headsets. And, after about 30, 40 minutes, it's not like it's as ideal if you really don't have anxiety, you know? Um,
Yeah.
uh, so, we learned a fair amount about using it with patients, how fast. Doctors essentially told us you have about 90 seconds to get a patient on board with the headset
Oh, wow.
on. So
Yeah.
90 seconds is quick. You essentially have to have one button in your intervention to be ready. And what's interesting is I made a comparison between Netflix VR. We were using that, and then versus the app that we had developed. And Netflix VR, understandably, wins on content, right? No one has more streaming content than Netflix. Well, it's not a torrent or something. And but the problem was in Netflix VR, it was like an Easter egg. You had to go point up to the chandelier. You clicked on that. The void theater popped up. You had to size it. You had to change it. It was like about 4 or 5 steps, and you're talking about people who've never done VR before. So it was much greater than 90 seconds. And now I think there's actually a company that's formed that does a dental VR now. They actually call their product Digital Nitrous. Good marketing.
They call it what?
They should have thought of that. They call
What do they call
their
it?
VR product Digital Nitrous. So
Digital
it's like
nitrous. Huh.
nitrous is for dentistry. It's actually the laughing gas.
Ah.
So yeah, clever.
Although I
But-
would never, I'll take laughing gas over VR for wisdom tooth extraction anytime. Like hell no. Yeah, it's yeah, but yeah. And so okay, so it's been used in dental anxiety, and you've seen that this effective intervention, and then it also sounds like, well, first of all, the other kind of thing I wanted to mention too, because you mentioned pain, which I think we should talk about, but also one thing that I've also seen is Stanford also had a VR experience, I think Braveheart, for children who were having heart surgery. Are you familiar? You want to explain that?
Yes. Yeah. So now let's talk about other procedures, right? So the other procedures, when we think about anxiety, there's like some levels of intrinsic anxiety, which is like dentistry, like having stuff in your mouth. It doesn't matter how much you know how good that is for you, like all the health benefits of getting dentistry done. There's something intrinsically about like, oh, I don't want stuff in my mouth. There's
Evolutionary,
a lot of other, right. You just don't want all this gear and stuff. But with the hospital, there's a lot of things that happen that are scary and unknown, particularly for children, but also for adults. That's just like, I don't fully understand why I'm having to do all of this, and it adds to the anxiety. And so I think
Yeah.
Bravemind had two components. One, it had one component where it kind of explains what at the level of the child, like what's going on by having kind of the providers inside the virtual reality experience. I believe so. I believe they had videos and projections of them.
Yeah.
But they also had distraction components. So it's almost like they did both.
Oh, and
And I've
patients.
seen lots of.
They were kids.
Yeah.
They were kids who had
Yeah.
gone through the surgeries, like
Yes.
a kid appearing in each place saying like, oh, like this is what you're gonna have happen to you now, and then you're gonna go in the MRI machine where you're not supposed to move, but it's gonna be kind of cool because this is the image that they're gonna be able to take, and this is how they're gonna do this and that. So it kind of like guided them through, and it was another kid also who had had the surgery and had been successful and like was
Yeah.
happier and all that kind of stuff. And
Yeah,
then they
kinda
also had
gets
the
like a bonding
distraction.
relationship.
Yeah,
Yeah,
yeah.
which I think is good to have both parts. You know, like you want
Yeah.
to tackle it from as many sides. Bravemind was great. I
Exactly.
think Walter did a great job.
Yeah, yeah. The Stanford did that. I think Brave Mind is the PTSD is actually a PTSD treatment, I think, for
Right.
combat veterans that
That's
they
right,
did
Skip,
as well. But yeah, Braveheart,
Yeah.
and so that's kind of focused on what's called procedural anxiety, as you've mentioned,
Right.
and kind of like medical procedures and things like that. And then there's also the world of pain, which I'm personally
Yes.
very interested in because I work in treating substance use disorders, and like I have lots of patients with opioid use and heroin, and basically they often get to heroin by being prescribed painkillers and opioids to treat different kind of after procedures, and they have excess amount, and then they keep taking it, and then they get into that kind of cycle of addiction. And so I'm very curious, like about how VR has been used to treat pain and potentially as an alternative to opioids, and de-risking that process of treating pain and not having people get hooked on heroin and things like that.
Yeah. Yeah, that's exactly right. That's exactly right. So we could start back in the year, so 1999, the first actual real VR pain program was made, and it was something called Snow World. And this gets into something really interesting, kind of the game design of it. So Snow World was essentially a game where you were shooting a snowball, and you would shoot snowmen as you go down a canal or river. And there were penguins, and it was made with a psychologist for pediatric children that have had third-degree burns, severe burns, and they're getting wound dressing changes that can be excruciating, just changing out the dressings of the skin
And why do they do that?
exposed to burns. So they do that. They kind of do this wet to dry process that they find is useful for the healing process because the skin is very dry and brittle after it's been essentially just exposed, and it doesn't have very good temperature control. You're getting lots of loss of water, and so trying to change these wounds allows kind of the ability to protect the skin, but also kind of help with the healing process through this kind of debridement process. It's also part of the cleaning.
And it's painful.
They're also resection. Oh, it's extreme. Yeah, because they're gonna each time you make adhesions with the skin to the dressing, and so that's painful. What's interesting is it's a very important population that if VR works there, it really blossomed to be used in a lot of different areas. So they use that in at least 8 different studies. Many of them had controls where they essentially let one group wait, and then the next somebody they use VR one day, and then they use VR not on the next day, and then or not even the next day. It was actually they use it for the first 15 minutes, and then the last 15 minutes it didn't, and vice versa. So that's how you control their experience, asking them how they felt about their pain. And so and just recently, in 2018, they published the first study that we've seen of reduced opiates doing wound dressing changes. It was a 9% reduction in opiate use during the procedure, which is
And
really
opioids
good.
are painkillers. Yeah.
That are bad, that can cause a lot of outcomes like constipation, and then after several days they can lead to causing addiction, which is an issue that we're having within the U.S. Quite a lot. So the hope is, I think, with VR right now, is that we're currently running a study, and Cedars-Sinai hospitals run several studies now looking at pain reduction. But the ultimate goal is that maybe we could decrease the total amount of opiates given. They may still need some opiates after a procedure, but just not 30 days worth of opiates, or even potentially 15 days of opiates.
I mean,
so, but
do you think that people they'll get desensitized? Like, I wonder for us, like, we all spend a lot of time in VR, and I'm wondering, like, would it be as effective for us? I mean, how many people think that this would be as effective for yourself, having spent a lot of time in VR? Thumbs up if you think it would be as effective. Thumbs down if you think that it wouldn't help with pain treatment as much because you've kind of gotten used to VR and it's not that not as kind of interesting as when you first had tried it. I'm just curious what people think here.
I mean,
Okay, so we haven't.
I think that's a great question.
I think it
Yeah,
depends
me,
on
man.
the pain. I think it depends on the kind of pain that like you're experiencing. If it's like mild or not even, then it might still help. But if it's like intense and it's kind of body consuming, I still think it would probably overtake what you're seeing. If you close, like if the pain is so bad that you close your eyes, for example, it doesn't matter like what's on your head. Something like that.
Yeah.
Right.
Yeah, Electro.
I mean, people can you can have emotional pain, I guess.
Yeah. I mean, that's definitely and pain also. That's a really good point because emotional pain that's more or pain that might be more psychosomatic, which means that it's kind of coming from your brain as opposed to like coming from your body. Then perhaps VR could actually really change that, and even just having the social connection. Yeah, sorry, go ahead.
I know that wasn't related to the fact of being used in hospitals, but I mean in general, like VR can actually cause that just because you're socially connected to people, in a sense.
Yeah.
So I just brought that up. I just thought of that.
No, that's a good point. Yeah, Pika.
I'm always interested in like these studies, exactly like what equipment. You say a lot about like the Samsung VR gear, and when I heard you say the time limit of like 90 minutes in Samsung Gear VR, I kind of winced a little bit because they don't have inner pupil adjustment with the Samsung Gear. That would, I mean, I've never spent that long in Samsung Gear. Yeah, it's bad. So has there been a study between the differences of quality within the VR sphere, or
That's a good question.
you are just like, because you're all testing on mobile, and mobile is not the best.
Resolution is low on mobile.
Yeah.
Yes,
it's
very.
I'm field of view.
I have a lot of negative things to say about the Gear VR.
I mean,
yes.
Very biased.
I bet the confined space within the mobile, because you have a less wide of FOV, might kind of feel constricting and might kind of cause panic or something, because you kind of feel like you're trapped in like a big mask or something.
Potentially, yeah.
It's just not good hardware. It causes brain shear.
I have lots of
Brandon.
Lots of thoughts. I'll start back. Maybe I'll go in reverse order because I have answers or some evidence for everything that was asked. So I guess I'll go back in reverse. There was a study done with Snow World that looked at different types of field of view, which is a key difference between some of the mobiles and some of the more high-end VR, and also graphical differences. And studies have different results. So field of view ended up being quite important. You had to be over 70 degrees of field of view to be immersed, it looks like, from some of these early studies. And then, but they did show in multiple studies, including one I did over at Mayo Clinic, that a Google Cardboard headset actually had pain reduction. Now we didn't look at whether they. No, we did. We looked at if they had done VR before, and that didn't have a statistically significant difference. Now it wasn't a high VR use group. This right here would be literally the highest VR use group, right? Because everyone's currently using VR.
We need studies with everyone.
You know,
We need all of you.
Yeah. Because the concern that was brought up first, I'm kind of skipping questions now. The concern that was brought up first about would high-end VR users have potentially a less of effect? It is a concern within the academic community. There does seem to be elderly, so when we do it with baby boomers, if they're willing to say yes to the study, which many of them are apprehensive about technology, if they say yes, they have a very high response to VR because they have very low. We hypothesize that they have very low, expectations of VR. So we do think expectations is part of this. So I would say the comfort of mobile is low, and we would only use more than 20 minutes for something like dentistry, where you're using traditional kind of traditional content. There's really not enough. Honestly, there's not enough immersive content on mobile right now to do more than like 20, 30 minutes at a time. But there's also a comfort issue. In all of the VR studies that use full VR in healthcare, almost all of them are about 20-minute long programs. So very few have done during acute pain studies for more than 20 minutes. We'll get into chronic pain maybe in a couple minutes. Then I got to go back to Mr. Mean. You had a great point about pain and the types of pain, and also Electro also brought up questions about the pain. So I would refer to this great study that was done in pain reduction, again with Snow World, where they actually got undergrads at University of Washington to sign up for a study where they would do thermal pain, which is like this little like burner that it sounds bad, but they burn their feet. It's not permanent, but it is painful. And they asked them to go into a functional MRI machine so you can see the brain activity. And it was a really interesting study design where it was 18 minutes of functional MRI running the whole time, and then it was 8 minutes of VR, 8 minutes no VR, and they would burn their feet every 2 minutes. So there was pain, no pain, and then VR, no VR. And they gave them drugs. They gave them pain meds as well in another half of the study. And what they found, which was really interesting, is that there's about 5 different areas of pain that lit up in the brain. And they relate to different things in our body. There's our bodily sense of pain, like my foot is burning, right? I have a connection within my brain, a certain area that tells me what part of my body is hurting, okay? And then there's another part of the brain that's our emotional cortex, or emotional area, the emotional area, not cortex, emotional area that we do have an emotion about pain. We think of burning, fire, even if we're not necessarily being burned or fire, we may imagine that, or we have a certain strong emotion or feeling about it. And we can sometimes get really anxious about it. Is it coming again, right? And all these areas decreased in size while in VR, and the decrease in size, of course, with drugs. But what's interesting is when you did them together, they decreased even a bit more. So they can be synergistic. So that was a huge study. So there really is, there's a lot to pain, but VR, what I'm finding is, what probably in the review of all, go ahead.
No, go ahead. Yeah.
I say in a systematic review of all the VR pain reduction studies, it looks like it's about a 22 to 28% reduction in pain, in all categories. And not only, you brought up something about functional, there's something called kind of functional pain, or pain that might be more driven from a mental or mind kind of origin versus a bodily function. That and a physical pain that you can actually point to both have the same amount of reduction in pain. So essentially, what that kind of somewhat tells me, I think, is that our conscious brain has some ability to tamper pain. We have almost like a buffer of pain. that we can somewhat control, and that VR can be quite good at dampening the conscious focus. Our RAM of our brain can be sequestered by VR. Yeah.
And one thing I wanted to quickly add, and Pika, we'll get to you in a second, is that in that study with the pain where they burned the foot, I talked to Hunter Hoffman, who ran that study, and he said that they had to build an entire, because one thing that everyone, like fMRI, you can't have any metal, so you can't just use any kind of headset. They built a custom VR system that used fiber optics to pipe the image into the fMRI machine while the person was there. And they had a pretty good field of view, although one interesting thing too is that you couldn't move your head. So is it really VR, or is it really just like an IMAX if you can't move your head and you don't really get to feel immersed in the situation? So
yeah.
Oh yeah, I mean, so essentially, I think that there were no cords attached to their brain, because the fMRI is more like a magnet that goes around your head. So good. But
Yes.
oh,
Yes. No, it wasn't like an EEG.
I think he has a delay, maybe. Yeah. Okay. So it wasn't an E. Yeah. It was like
Did I
an
pause
fMRI with magnets going around. Just for a second. Yeah.
Do you have a gaming computer?
But yeah.
Your computer might be struggling.
If
Yeah.
that's the case, then we should
Do I
probably
need to
switch
check
to
this
more
real quick? Hold on.
performance-friendly avatars.
Oh, okay.
Yeah.
Yeah, just like. Oh no, it's. They might be lagging. They might need to block some avatars.
Yeah.
Yeah. Okay, so.
Yeah. Maybe.
Just go on maximum safety mode. I'll open up your menu.
Okay.
Okay. And then go to safety on the upper right hand corner, and turn it on maximum.
Which is the upper left, yeah. And then close the menu.
Yeah, and then close.
Yeah,
the
that
menu.
actually helps for me as well.
That should help you.
Oh, that's much better.
They've done this.
Cool.
Okay, there you go.
Yeah. Thanks.
Okay. Cool. All right, Pika.
Yes, I do have a question. All right. So this is kind of a two-part question. You said that elders are more, responsive to VR. All right. But is there data to how many elders reject VR to how many elders, allow VR to happen?
90%
And
reject it.
90% rejected.
Wow.
Okay, is that
high.
data available publicly?
Yeah, I can send you
And
the paper.
Yeah.
We can post it in the
Also,
Discord. Yeah.
Yeah, if that data is available publicly, I could. And then also, is there data on like what type of person, like because I noticed this might be anecdotal, but I noticed that a lot of like older females, they get a lot more dizzier in VR. Is there any study on who gets nauseous and who doesn't get nauseous in VR, and who responds well and who doesn't respond well, as far as like long term? Because I've noticed that some people they really take the VR very well, and then other people they'll end up in the vomit bucket. Like, is there data on that?
Yeah,
Where can I find it?
It's conflicting. It's actually somewhat conflicting. There's a group in Australia who's doing a review right now.
Do they also include in their data set? Do they include what hardware and
exactly? That's
the
hardest part about it.
The problem is that like a lot of these people they don't have the heart.
There's not standardization.
Like,
yeah, I think we've reached a point.
Standardization testing.
Yeah, well, we've reached a point, I think, where the 90 hertz, although Oculus, I guess, feels like 80 hertz
Let it be known,
good enough.
I have a lot of bias towards Samsung Gear. Like, I do not like what Samsung Gear does.
We've reached. We've reached a point where the standardization of hardware, I think, is getting so good, especially with things like the Quest and the Go, that hopefully moving forward, we'll be able to understand data with a more standardized, like, performance set of headsets. But yeah, move backwards. Not all studies actually do account for the headsets.
They don't, but so in that systematic review that they're doing, and hopefully it gets published soon, it's there are a few things that have come out as like kind of gold standard, like yes,
Okay.
this should happen. So 60 frames per second is an absolute real deal. So that's come up in several studies that, and I've had several patients. So on my current study, which is a chronic pain study with, going to have 174 patients. The few patients that have cyber sickness or virtual reality sickness or sim sickness, whatever you want to call it, they all essentially tell me when they turn their head, and we are using we used to use
Yes.
the Samsung Gear VR, now we're using Oculus Go, but even then you can still have moments where the frame rate can drop
Oculus Go is
below
still
60.
Oculus Go
it wants
hardware
to be
is
at
barely
72.
above Samsung.
Yeah, right. It wants to be at 72 if you really push it, but it doesn't have to. It can still be at 60 or below 60, but it can tell because the patient will say, when I turn, it looks like the speed doesn't go as what I expect. And I'm like, that's exactly
Is-
it. Like, that's for sure they're getting sick.
Can you post that data set in the Discord, please?
Yes, we will. So we have a Discord, and
Thank
if
you.
you go to endgamevr.com, we have a Discord there that you guys can join. Also, for anyone who's just joined us, this is Endgame, where we kind of have discussions about different topics. And tonight we have Dr. Birckhead, Brandon Birckhead, who's at Cedars-Sinai Hospital, and he's done a lot of research with treating dental anxiety, kind of general anxiety with medical procedures, and also pain using virtual reality. So we're kind of having a discussion. If you have questions, you can line up in the
Okay.
center.
I'll contact you later, Psych. Thank you. Thank you so much. Thank you.
Yeah.
Yes, thanks, Pika.
Yeah.
Yeah, and on the
And
Discord,
before
Bruno
this next one, I do want to say one thing. So just in case for time, I do think there's also something really interesting about game design. And maybe in a bit, if anyone's interested, there's a lot of interesting game designs that are coming out for chronic pain. And some of them relate to some artificial intelligence, relate to like biofeedback with metrics and how we use our heart rate, and even like embodiment with avatar. But I'm really excited for that. But I want to make sure I also answer. Yeah.
Okay, cool. Yeah. Dirk?
So, just you're going on about how older folk tend to have a wee bit of a problem dealing with VR, getting into it, right? And I understand that currently, as we're speaking, you're primarily dealing with the mobile versions of what we currently have on the market. I was just wondering if there's a lot of these headsets now, and it would be a little bit more of an expensive endeavor where you get the wireless on the computers. And I know that there are computers at most hospitals that can deal with this kind of HMD, as you were saying. But my question was this though: if that was to become an option, would you possibly maybe put in, especially for elders, because this may make or break, an idea where the family members that are in the building at the time that the event's going down, whether it be dental or whether it be some other or maybe even at home, because it's online. Half these people probably live halfway around the world.
Right.
Could join and be there with them while they're going through it. That kind of comfort is something you can't get when you've got doctors all around you. Like right now, obviously we're not standing near any one of us that are in this room, but that would be something where I think I just wonder, is that something you've already thought about? Maybe is my question.
There's this organization. A great question. AARP, which is like the elderly organization in the U.S. Actually has a developer innovator like incubator inside of it, and they made an app. So on the Oculus store, you guys should all look up Alcove. So Alcove is the senior citizen app for VR, and you can actually, I think, do a social connection where you can have family members come in with the elder, and you can put in photos. You can kind of do a bit of reminiscent therapy where you can kind of reconnect on especially if they have dementia. And so that is something that's happening. Social VR will be a huge thing for therapy.
Yeah.
But your point about the high-end VR. So I help run right now at Peters, probably one of the largest therapy programs in a hospital. So they've treated my co-director, but also my boss, Dr. Brennan Spiegel. He created the program about 4 years ago. They've treated about over 3,000 patients now, and of those 3,000, about 10 less, yeah, 10 have had like serious cyber sickness.
Really?
Still can go away with it. So that's
pretty low.
So it's interesting. It's pretty low, and the reason is that the content that's made for therapy is very, very different than what you're playing. So everything you're playing is unlike most VR therapy. So therapy is made to be low risk of cyber sickness. So in all the reviews that have been done for cyber sickness, one thing that comes out over and over is the type of content is actually very important for why it's going to cause cyber sickness, and it's all about the visual flow. So if I'm playing a first-person shooter game, the visual flow of content can be very rapid, and a lot could be going on, and I might need to move my body across the a couple feet if you have a Vive, or you got cameras whatnot tracking you. So with a lot of these are stationary games. They are low flow, and a lot of them. So if I was to break down all the different types of pain reduction VR programs, I would say there's a bucket of like stimulating interactive that's can be kind of like a calming shooter, like Snow World. There's another bucket which is kind of relaxation, meditation, deep breathing, a bit of skills training, maybe like light CBT, if you will. Another group is like kind of just escaping and 360-degree videos, kind of a passive VR, if you will, and also minimalistic in a way, but also calming. And then there's starting to be some AI-driven narratives, but that's really, we're not there yet. I think it's the future, but all that's to say is that because it's so low, for me, running most of this with a team of maybe 5 or 6 people, it's huge for us to have mobile, because the high-end computers, it took me 25 minutes to get this Windows up. That literally, like,
yeah. Although I think a big game changer.
So it's a logistics.
A big game changer, I think, I did a study actually with 241 patients and putting them in games like Beat Saber and really engaging games, like that are really activating and things. And those are actually, I do think that there is some fear in the medical community of like using, downloading pre-existing apps and stuff. But we saw huge reductions in anxiety and shame and an increase in positive emotions like excitement and hope and engagement. So it's just interesting. I think the Oculus Quest, when it comes out next week, which I'm so excited about. I know. But when it comes out, like, it's going to really change the paradigm in medical setting, I think, because you are going to be able to bring someone a crazy immersive experience, remotely. So you'll have 2 hand controllers with 6 degrees of freedom, and you can pick things up or point and interact. And it's just going to be, I think, a game changer in terms of the fidelity of the types of things that we're able to do.
The Quest is going to be amazing. We're definitely buying it.
Well,
we did.
I appreciate the input. It was just something that I've let my grandparents take a good look at this, and even they say the whole sickness deal. But if it came down to the line, that was just something where, as you just explained, it's definitely important. So,
and also,
thank you for
Yeah, thank you, Dirk. And also, another thing is that medications have side effects, right? Like nausea is a side effect of some medications that people take, and they take it because the medication is worth it. So also for now, we say, oh, VR is causing nausea. They can't use it. It's not going to be helpful, but maybe we can kind of explore, like, does the nausea go down over time? Is it worth it? Yeah, exactly. So like, what are the benefits?
Studies
yeah.
Decrease. What I like to do is I do a minute on, I do a couple minutes off, I do 2 minutes on, a couple minutes off, and actually, if you do a little bit of kind of like de-escalation of kind of anxiousness by doing some even a little bit of deep breathing beforehand, and make sure you're really in a seated position, you can decrease the symptom significantly for a lot of the patients. Yeah.
You should publish that. That would be really good to.
Yeah. We'll probably wrap it into the whole traveler study. The whole traveler study is going to end up being like 4 or 5, or at least 3 papers.
Oh, great. Okay. Yeah. Cesare?
Hello. You were talking about how virtual reality is better for you said social anxiety, right? For is it for like people with
There
social
can be.
anxiety are more
It can be.
connected
Yep.
to it?
Yep. True. There are programs for
Yeah.
that though. Like there is social anxiety programs, or actually, I should say not social anxiety. It's public speaking is probably one of the most common. But
Yeah.
yeah.
What I was talking about, what are other people, the people that are not connected to virtual reality as well compared to mixed reality? Is there any studies on that?
Oh, so using mixed reality to help.
Like
Yeah,
AR.
using mixed reality instead. How's that? Has there been any studies
It's
on how
interesting.
that's affected?
Well, there has been some, and it kind of goes back to the reason for it. So, with mixed reality, you gain a lot in your ability to add it within your own environment, kind of add context and interaction, but you lose a little bit on immersion. And I do think that's why in 20 years we will still have VR. It doesn't matter if Apple comes out with the mainstream use of mixed reality glasses, right? We will still have VR because so this is what I think
Exactly.
about mixed reality and augmented reality. I'm very excited about augmented reality and mixed reality. I am experimenting with it, but mainly as a tool for education and engagement because it's so scalable. I can do a lot of even with just a phone, But if it was pain, if the point is to cause someone to not have a thought or not have an emotion or to shift from one emotion or one feeling or a state or so with pain and sometimes anxiety during a procedure, you would want full VR. So it's like during the dental procedure or during, surgical procedure, in someone's clinic, I would want a VR headset on me. But beforehand, if I'm going to learn about the procedure and the doctor's going to try to explain something complicated like a cancer procedure, it doesn't have to be in VR. You could do that with an augmented reality experience. It could be quite fascinating. You can share it with family. So that's how I think about augmented mixed reality versus VR. I don't know about studies comparing the two, though. That's a great idea. Am I lagging?
Yeah. Yeah.
No?
Yeah. Thank you, Czar.
Thank you.
And
Okay.
and
Have a nice day.
yeah,
Thanks.
and we're getting towards the end here because you like to keep it to an hour. We have about like 10 or 15 more minutes. So
Oh, yeah.
yeah, but yeah, these are great questions. So keep them coming. And yeah, Electro.
I think you're muted, dude.
Oh, I was gonna say I thought my
I'm sorry. I forgot I muted myself. What would the long-term effects be for someone who's a long-term user of VR versus someone who just uses it once in like the medical,
Oh,
like
great
and
question.
I was thinking about that because like I've heard of a couple things like something I don't know if I understood the article correctly, but there was something to do with like how like there was like a shrinkage in like the hippocampus in like mice or something. I don't know if I read that correctly. That it was just some
How
like
you
article or something.
how are you getting mice in VR?
Don't
Well,
ask.
that's a great point.
Don't
Actually, no,
ask.
it's
cave
funny.
system.
It's
Yeah,
yeah.
somebody
It's a
somebody
whole
just did a
system.
master's thesis on that. Yeah, you can't actually put mice in VR. I mean,
You
we
could-
don't
Yeah,
totally
it was
share
an
You
actual
put the
system they
cages.
set up.
You can put the sides of the cages as screens,
Like
so that it's
Yeah.
called a
you
cave
construct little
system.
headsets for them. You give them little Vive controllers.
That's what I imagined when I read the article.
It's like cave.
But
Yeah.
Yeah.
they actually used like what he said. They actually used like screens that would be kind of similar to what we experience in a way. But I don't know if that's
It really enhances
accurate
the mouse
study.
wheel. The
Yeah.
ultimate treadmill. Yeah.
Yeah.
But yeah,
Um,
that's a good
Doesn't
question.
sound validated.
That's a good question. There's no studies on longitudinal use yet of VR. Will be something that hopefully we study at some point. But it's
Yeah.
definitely a concern that's out there in the community. So far, we're more concerned about like game addiction in traditional games. So there could be an issue with long
That
term,
is actually true.
VR, but that's not intrinsic to VR. It's intrinsic to the nature of the game design. Potentially, or actually, I'll leave that to Noah. That's more his. I don't actually know
Well,
much
also,
about gaming addiction.
I mean, we
Yeah,
are
that's
the
pretty
new
good.
frontier. Like, there's never been a group of people like us now that have been spending so much time in VR. So it's a new question, and I'm hoping eventually that you guys will be able to participate in studies like that. You can
Yeah.
download a study and participate, and we can get data
Ooh.
on that kind of
I do
stuff.
have a
So,
question. What if, and this is always something I'm interested in, can we get a show of hands if Steam VR had a game that happened to be a research study? Who here would be willing to participate?
I did one of
in VR?
those in PsychLab VR. Yeah, I did one with PsychLab VR. I had 550 people come in and do a study on social anxiety. So it was pretty cool. Yeah, you can get a
You're the
lot of people that
pioneer.
way.
That's awesome. That's so cool.
Yeah. So it's a cool VR chat, and the community is a great. People are really down to help out with that kind of stuff. So it's pretty
That's
cool.
awesome.
But yeah, all right. Thanks, Electro.
Welcome.
All right, we'll have to cap it at Glade because we're getting towards the end here. So Nikon, you can come up.
Sitting.
Hello.
I have a question via and education, basically, and the creative aspect of VR. Has VR made people more creative?
I've seen, I think you've maybe seen some of these studies too. Tilt brush has actually been used. I don't know about necessarily creative. I'm sure it has, but it's been used in for art therapy.
Has it? I haven't seen that.
Yeah, it's a really cool paper. I'll send it to you. It's
Yeah.
the group Frontiers, one of the Frontiers, and they used it, I think, for anxiety and depression, generalized anxiety and depression. They used it for as a venue. So the art tilt brush is a great tool. Yeah.
And is there any like has there was there any like advancement, complete immersion and learning stuff in VR instead, like a classroom or
Ooh.
something?
Oh. There is a lot of literature on VR use for learning. There's a guy at Harvard who is kind of the father or the leader in VR for learning, but I don't know much about learning in VR, to be honest.
Okay.
Yeah.
Sorry. But great question.
Okay, thanks.
I can
Thank
send you
you.
whatever I have.
Yeah, we can try to send some papers on that though. I think there's a lot of research on education in VR. We're more focused on the kind of discussing the kind of health anxiety and the anxiety and pain treatment and things like that. But yeah, I think that VR has a lot of potential for education and I mean these kinds of things hopefully are educational as well. People learn and have discussions, and I always learn a lot in these kinds of discussions. So, but yeah, thanks for the question, Nikon.
Thank you.
Yeah. All right. Paro Tato.
Hello. So in
Hey.
the beginning of the talk, you talked a lot about people avoiding doctors and dental appointments due to the anxiety they cause. And throughout the talk, we've been mostly focused on easing that anxiety once they're in the doctor's office or in hospitals. Is there any studies being done, past or present, to ease the pre-visit anxiety? Because I imagine people avoiding care that they medically need is probably a pretty large issue.
Yeah, that's fascinating. Yeah, there is, and it's kind of been two different types of studies we've seen. One is if it's a really bad anxiety, it can actually be to the point where you would call it a phobia. So there has been at least 3 studies on dental phobia, and in that case, your phobia is a whole different ball of wax, which I'm not a psychologist, nor one that specializes in VR desensitization for phobias. But what I have seen is essentially they show what that trigger is, and slowly over time change the environment to make it either more and more realistic of that situation. And there's always a trained psychologist there to help with the trigger point itself. So it's, I don't know if it's necessarily at home, but a lot of, like, if it's to the point where you really just can't go at all, then that's kind of or there is a process for that, and a provider for that. Go ahead.
Yeah, no, well, also, I think like you're making a really good point that it hasn't been explored. But what if you had a dentist office in VR chat and people could go in and pretend to be on the table and doing things, and like would that just help with anxiety a little bit and desensitization? Like I think it's a really good idea that not only can we use it in the clinic, but you can also have a preventative type model where even people who aren't that anxious about it, it can reduce their anxiety and potentially, there's a group of people who never go to the dentist, but then there's another group who probably delay going to the dentist and try to avoid it until they have a really bad problem, and they could maybe benefit from this kind of a thing because they would be more open to going to the dentist, if they were able to kind of overcome those slight fears, not the intense phobia, but even like the slight fears. So yeah, it's a really good idea. I don't think that exists at this point.
I don't. Yeah, I've seen one study with 360-degree videos, but that's again more about knowledge. It was for I think a neurosurgical procedure that was for the spine, and so they would send out these 360-degree videos. But it's really the remote use of immersive technology has not been published much at all yet. So
Yeah.
For the future.
Yeah. Good question.
Great question.
Okay, great. Thank you very much.
Thanks. And Glade.
Okay, just gotta make my mic is on now, right? Yeah.
Yes, we can hear you. Yes.
Not so much of as a question as a comment. Last week I had an epileptic seizure, and I was stuck in the hospital for half of the day. And I don't know if I missed anything on this, but to the anxiety in the hospital itself, there was actually a gentleman that was next door to me, and he was losing his mind because he couldn't handle what was around him, couldn't do anything with it. But at the same time, he had the TV turned on, because they have TVs on every one of the tables in or every one of the little areas in the emergency. And he was the only one with it on, so I'm wondering, it's a little bit more difficult with emergency situations. Like the guy was in there for alcohol of some range. I obviously don't know too much, but he ended up pulling his IV out and running out, saying he can't handle it. He can't handle it because he can see everything that was going on. And I don't. Again, I missed some of what was said because I was trying to get online, but I think it actually could be a really great thing. But there needs to be a headset of sorts, not necessarily mixed reality or whatever, that's less intrusive to the person's face. Something that doesn't necessarily have to be strapped on quite as tight as most of them do.
Yeah.
If that makes any sense. Because I know that can reduce a lot of anxiety in the emergency rooms or anywhere for that matter, just being able to be like, we can put you in a calm place. If you want us to, we need your permission, obviously, and it won't be entirely uncomfortable. Because I'll tell you right now, those beds are horribly uncomfortable.
Yeah.
Yeah,
just wanted to weigh in.
No, that's a really good point. I mean, I think there's all levels of stimulation that we can potentially provide within hospitals. And I mean, if you imagine the technology became cheap enough, why not just make all the walls able to turn into a nature scene? Make every room into a cave system. If there was some kind of paint and things like that you could do.
You say that, but at the same time, in the emergency room that I was in, they had lights that were clouds. It doesn't, that kind of thing doesn't help, because if it's just around you, you're not going to pay attention to it. It does
Blends
have
into
to be
the background.
It has to be with you.
Intention.
So actually, you know what? I guess one of the things that they can do is
You mentioned the surrounding reality or virtual reality, whatever it is with the screens. At each bed, they have a privacy drape.
Yeah.
So that people can't see in and whatnot.
The projector on
If
it.
they could find a way to put it upon that, there'd be nothing added to the person. They could then add it to people who have injuries to the point that they can't wear these things, and they could actually, create a better environment for them to calm them down.
Yeah.
Mm-hmm.
Interesting.
Yeah.
Interesting.
And
Yeah.
it'd be zero intrusive.
Yeah. No, I think these are all potential solutions as well. And I think I'm glad that you guys are starting to think about this kind of stuff. And it sounds like there's also new opportunities for people in here to, be thinking
Spend
about
enough time on one of those beds, and you think of these things.
Yeah. Yeah. Well,
Absolutely.
thanks, Glade. That's a really good point. And yeah, and so I guess yes, and so we do like to keep the show to an hour, and for your guys' time, to respect all of you guys for coming and everything. So, any last thoughts, Brandon, that to wrap up before we take our group picture?
Yeah. So I think that my last thoughts is really you could empower yourselves as you're going in. There's physicians that I know of that use that allow their patients to use VR. You always need to ask your provider if they're okay with it. But if you guys ever feel the need, there are things like like Netflix VR ended up working for a lot of our patient industry. And so if you guys are the type of people that use VR and find it to be of helpful, definitely let us know. I'd love to know. Yeah.
Cool. And if you guys have other questions for Brandon, if you go to endgamevr.com, we have a Discord link there, and you guys can join the community, and we have all sorts of discussions there. But yeah, well, thank you, Brandon, and thank you everyone for coming and for all of your very interesting questions. We're going to do a group photo, so hold on, let me.
Picture time, yay! Woo!
Yay! Picture time.
Open mouth time, yay!
Shift F5.
12 minutes. What do you
I only look good on my drunk side.
Oh.
My usual safety friends
I'm
are
not
here.
shit.
Oh my God, there's so many Shivas here.
Dude, there was only Shibas at the beginning from what I saw on YouTube.
Oh, security off. There we go. All right.
Yeah.
All right, guys, come up to the stage. Let's take a group photo.
Come on, my children! Come
Brandon.
on!
Oh, we're going up?
All right. look at all the doggies!
Wow, this is awesome.
You and I will have words about the children thing.
I know, this is great.
Oh, man.
Wow.
Glade is the mother.
Hey, Zach, get here and lay down. Get here and lay down. Make good. Petey, come here. We'll
I
kneel
love
down
it.
a little bit.
Don't worry, be happy.
Sure, that thing they said.
Yeah.
Cool.
Cheese?
Yay.
Alright, yo, Shiva Squad! Shiva Squad!
Awesome.
Shiva Squad, come here! Shiva Squad!
Then you fall.
Okay, we're gonna perform a
I
rollout.
know, right?
We go to the DeLorean
hell
exit,
yeah.
and then we hit respawn at the same time.
We're gonna lag everybody doing that.
Okay, anybody who
I'm
doesn't
lagging
have
pretty badly right
Shiva
now.
Squad!
Really?
Wait,
Yeah.
Anybody who doesn't have a Shiba, if you want to ride to the future, hop on. Any of us have seats.
Oh, God. Oh, boy.
Ginger snaps.
Oh, boy.
Yeah. But, for me,
Use your emote,
for about
and
2
they're
years.
their DeLorean.
And it took me about 2 weeks
Not that
to
evil.
get my VR leg
Oh, yeah.
before I started.
Safety
feeling
mode.
comfortable.
Enter safety mode, everyone.
That makes sense.
You can turn on safety mode, guys.
I don't
Oh, man. That was insane.
Hang on, I gotta turn this voice
That was bad.
That is basically the guy that's being followed around by all the Shivas.
Oi! Let me